Hello to all dear friends. I'm Sophia and you're listening to the Healthify channel. This channel is a specialized channel in the field of health and medicine, where we review drugs, diseases, diets, medical tests and experiments. If you are interested in learning new and useful information in this field, be sure to follow our channel and share with your friends. In this video, I am going to talk to you about a widely used drug called metronidazole. You may have heard what kind of medicine metronidazole is and what its properties and side effects are. But do you know how to use it? What should be observed before and after using it? What questions do you have about it? I will answer these questions and many more in this video. So stay with me. What is metronidazole? Metronidazole is an antibiotic used to treat bacterial and protozoal infections. This drug works by inhibiting the growth of some bacteria and parasites. Metronidazole is sold under different brand names such as Flagyl, Flagyl R, Flagyl IV, Protostat, Metrol, etc. This drug was discovered in 1959 by a French pharmaceutical company and since then it is one of the most used drugs in the world. What infections is metronidazole used for? Metronidazole is used to treat various bacterial and protozoic infections. Some of these infections include bacterial vaginosis, a vaginal infection caused by changing the balance of natural bacteria in the vagina. This infection causes the vaginal discharge to acquire an abnormal color, odor, or volume and may be accompanied by itching, burning, or pain. Tooth abscess, a tooth decay infection that is accompanied by pain, swelling and sometimes bleeding. This infection may cause the tooth to vibrate or become sensitive to cold or heat. Gum disease, an inflammation of the gums that is manifested by bleeding, swelling, redness and sensitivity of the gums. This disease may cause the gums to separate from the teeth and create an empty space between them. Pelvic inflammatory disease, an acute or chronic infection of the uterus, fallopian tubes, or ovaries that is accompanied by severe pain, fever, unpleasant discharge, and discomfort during intercourse. This infection is usually caused by sexually transmitted infections. Rosacea, a facial skin condition characterized by redness, pimple-like lesions, itching and burning. This disease usually occurs in green-faced and garlic heart people. How to use metronidazole? To use metronidazole, you must follow your doctor's instructions exactly. This medicine can be used in the form of tablets, capsules, syrup, gel and injection. Depending on the type of infection you have, the drug will be administered orally or intravenously. Drink plenty of water before taking the pill or capsule. Before using the gel, wash your hands and apply the required amount in the vagina or on the skin of the face according to the doctor's instructions. Before the injection, the nurse or doctor will prepare you and inject the right amount into your vein. Use the medicine for the duration prescribed by your doctor and do not stop even if your symptoms improve. If you miss a dose, take it right away and then go back to your regular schedule. If it is almost time for the next dose, skip the missed dose and take the next dose at the usual time. Do not take 2 doses at the same time. What side effects can it have? Metronidazole may cause some side effects. Some of these side effects include dizziness, headache, fatigue, nausea, vomiting, diarrhea, sore throat, change in color or taste in the mouth, dry or sensitive skin, fungal infections in the mouth or vagina. These side effects are usually mild and can be helped by continuing to take the medication or using tea, lemon juice, candy, or toothpaste. If these side effects become severe or persist for a long time, contact your doctor. There are some rare and serious side effects that are signs of damage to the nervous system or liver. These side effects include convulsions, stuttering, visual changes, weakness, numbness or tingling in the hands or feet, behavioral or mental changes such as frustration, confusion, anxiety, and change in color or smell of urine, severe or continuous abdominal pain, fever, nasal discharge, or blood in vomit or stool. These side effects are dangerous and indicate that you should immediately stop using the drug and see a doctor. What are the recommendations regarding the use of metronidazole? To use metronidazole correctly and safely, you should pay attention to several points. Do not drink alcohol while taking the medicine. Alcohol may make your side effects worse or cause liver toxicity. Do not use common birth control pills, containing estrogen and progesterone, while taking the medicine. These pills may reduce the effectiveness of the drug or cause fungal infections. Use other methods of contraception such as condoms, mechanical devices or natural methods. Avoid eating spicy, salty, fried or fatty foods while taking the medicine. These foods may irritate your stomach or liver or increase the production of stomach acid. Instead, eat light, healthy and balanced meals. Avoid taking iron, zinc, calcium or multivitamin tablets while taking the medicine. These pills may reduce drug absorption or cause drug interactions. If you need to take these pills, you should take them at least 2 hours before or after taking metronidazole. While taking this medication, tell your doctor what other medications you are taking. Some drugs may interact with metronidazole and decrease or increase their effect. Some of these drugs include warfarin, phenytoin, lithium, cyclosporin, chloroquine, etc. I hope this video is useful and informative for you. Please leave your comments in the section below and tell me what topics to cover for you in the next videos. Also, don't forget to like, subscribe and hit the bell so you don't miss any new video. Take care until the next video. Bye.